Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're talking about tanning and sun exposure, and we're joined by Dr. Maloney, who is the Chief of Dermatology. So we've all been told that sun exposure is good for our skin's ability to get vitamin D. How important is vitamin D?
Sun exposure does in fact convert some of the pre-vitamin D to vitamin D in the skin. You really need less than 15 minutes worth of sun exposure in only a limited area to do that conversion. Longer exposure does not increase vitamin D levels any further. Beyond that, in our food sources today, we have lots of ways to obtain vitamin D. Our milk is fortified, our bread is fortified, breakfast cereals are fortified. Vitamin D occurs naturally in many foods. So in truth, at this point, we need minimal to no sun exposure to obtain normal vitamin D levels.
How many years does it typically take for someone to see the effects of skin damage from the sun?
We know that it increases over time, and there are many things that change with exposure to the sun. Number one, we wrinkle. As we get older, we wrinkle as a result of the sun exposure we've had throughout our lives. That wrinkling tells us, as physicians, that somebody's had a moderate amount of sun. And so for those people with extensive wrinkling, we look at them even more closely. Other kinds of things, we see the incidence of both basal cell and squamous cell skin cancers, what are called the non-melanoma skin cancers, increasing as people age. And the most common age groups that I see are above 60 with those kinds of skin cancers, although they can occur earlier. And lastly, we do see an increasing incidence of melanoma as people age. And so we know the effects usually follow 20 to 30 years after intense sun exposure. If we increase sun exposure down to our children with ultraviolet tanning and a lot of beach exposure, and they have tremendous sun exposure when they're 10 and 12 and 15, and you add 20 to that, we're now looking at skin cancers in the 30s age group. And that is much too early to have skin cancer.
What level of sunscreen is best?
We say a 30 or better. But I will tell you of one very interesting study that occurred a few years ago. And we tell people they should be using 2 ounces of sunscreen when they apply it. And that's a full shot glass. That's a lot of sunscreen. And most people go, ooh, I don't ever put that much on. So the study went along these lines. They asked people to put on their regular amount of sunscreen, and then they tested how protected they were. And what they found was that if you used too little of a 30 sunscreen, you essentially had the equivalent of a 15 sunscreen. If you used a 15 and didn't use enough of it, you had the equivalent of a 7 sunscreen, so you kind of have things. We know how hard it is to get 2 ounces of sunscreen on all over you. And so we think that, yes, go up on the number of your sunscreen, go up to a 50, go up to a 60, and then if in fact you don't get enough on, you're more likely to have the protection of a 30. So the quick answer is use a 30 or better. And if you're not going to be using 2 ounces of sunscreen, go up on the number of sunscreen that you use. I do suggest to people they will tan somewhat through their sunscreen. At the end of the summer, they will have more of that glow than they have at the beginning. But they need to protect themselves in every way. And I recommend for people who don't want to feel gooey or sticky with a sunscreen to wear a hat, to wear sunglasses, to cover up, to use some of the sun protective clothing, to be under an umbrella, and have shade available when you're doing activity.
What is the difference between spray sunscreen and liquid sunscreen?
When spray sunscreens first came out, they seemed so easy to spray a couple of spots and you were good to go. What we found is that you spray not quite enough and then you don't spread it very well. So that we find very splotchy applications with spray sunscreens. You know, good protection here where you sprayed it on, but not so good right next to it. And so in a few people who've gotten a sunburn with that, they have good protection and they have a very patterned sunburn. If you're going to use a spray sunscreen, make sure that you spray adequate amounts and then you spread it with your hand to try and get an even application so spots aren't missed when you use it. Because of that tendency to spray and go, we do think that the liquid forces you to spread, and so you get a better even application. But either can be used if you pay attention to the application as you're putting it on. And please, please, please put it on your kids and make your kids know that sun protection is something that is a regular part of going to the beach, going to the swimming pool, and being in outdoor activities, at the soccer field, at the baseball field. For kids, it's very much like seatbelts. If you use them regularly and it is an expectation in the family, everyone in the car buckles up. If it is an expectation that everyone puts on their sunscreen and wears their hat and their sunglasses, they will act accordingly and remind us, as my granddaughters will, when I've forgotten to put on their sunscreen.
How important are sunglasses?
Well, sunglasses are very important. Number one, we actually see a fair number of skin cancers around the eyes where we can't get sunscreens. And so sunglasses add that level of protection to the skin. But also, we do know that extensive sun exposure over years will cause cataracts. And while you're not going to come to me for treatment of your cataracts, I'd like to help my friends, the ophthalmologists, and say that sunglasses may well help prevent cataracts. And so we get a twofer, less cataracts and less skin cancers around the eyes.